In the chapter, you will see how to assess that problem, the painful total hip replacement, and how to manage with hip arthroscopy in very low number of cases. So let's see. These are my disclosures. So mainly you can divide into soft tissue problems or hard tissue problems. This is very easy, but it's very useful when you manage this painful total hip replacement. Let's see what happens when you could have these soft tissue problems like synovitis, adhesions, or some kind of extra-articular structure damage. You can see some kind of synovitis or adhesion in these patients, but to be honest, I'm not completely sure that when you do this hip arthroscopy in a total hip replacement, this is the main problem. In this situation, these are resurfacing, as you can see here, and one of the main problems when they're using this hip arthroscopy in hip resurfacing, metal, is sometimes you can reflex the image, and it's very difficult to get a good orientation and where you are. So I recommend to use X-ray intraoperative. So for this patient with total hip, the main problem that we usually find, and we do the indication for total hip arthroscopy, is the extra-articular problem. You can find this heterotopic ossification that could be painful. Sometimes you have some trochanteric problems in this patient, but mainly the problem that we usually find here is the iliopsoas painful in a total hip replacement. You can approach this iliopsoas irritation or problem in this patient with total hip replacement, just focusing the area of the iliopsoas in the lesser trochanter, a little bit proximal in the peripheral compartment of the hip, and more proximal at the labrum level. If you go to the labrum level, you must know that 40% of the area of the iliopsoas is a tendon, and 60% is a muscle. So when you go with the arthroscopy, you can see like that, a very small part of that is a tendon area. We are in the proximal part in a right hip with a total hip replacement. And you can see in the medial part of this area, you open a little bit the capsule or the fibrous tissue that you can find there in a total hip replacement that looks like a capsule. And you nicely can see this white area is the iliopsoas tendon that, I repeat you, is the 40%. So there is no huge muscle damage, and the function of this tendon here can leave you the motion of the patient and the strength of this muscle with this 60% of the muscle area that you don't cut. You can see here the white area and how you can treat that. Usually you can find this redness area here. That means that there is an irritation in this iliopsoas tendon, and you cut this tendinous part of the iliopsoas. You can see very nicely in the chapter of the book, but this is like an introduction and a spoiler of the chapter. I recommend you to go to the whole chapter. So you can also treat this iliopsoas and cut it partially in the periphery, a little bit more distal, and these represent 43% of the whole thickness of the tendon. And finally, it's very popular to go to the area of the lesser trochanter. For me, it's a little bit more difficult. I prefer the proximal one, the area of the labrum, but you can go here and you can cut. But remember, this area can go to the 60% of the tendon or maybe more than that. So be very careful with the less of its strength after the iliopsoas release at this area. You can see an example of how to cut in this area. You can see a very nice white tendon. It's very, very grateful to cut here and to do the release here, because you can find like a tendon. But again, be very careful, because you will cut a lot of the thickness of the tendon. What about the hard tissues? You can find some kind of loose bodies in this total hip replacement or bone prominence at the femoral side or at the acetabular side. this bone prominence in this area, this is a case of a resurfacing that maybe was a CAM deformity where you do a total hip replacement, hip resurfacing, and you don't remove this CAM area. That's a mistake. You have to do it before to implant the resurfacing. But you can do with the arthroscopy. You can find this impingement here. You can do this resection with the standard hip arthroscopy. The capsule usually is very thick because are young people mainly, and you can get in like a standard hip arthroscopy without traction. You have to start in this area and find this impingement area that you can check with the motion of the patient, and then you can resect with a bar like you are doing a CAM resection. But be very careful with the reflex of the structures in the metal, in this case, as I told you before, because sometimes get you loose in this area. So you can find also the prominence in the acetabulum, some kind of osteophyte that you not remove at the total hip replacement time. And you can do it again with this bar in a standard total hip arthroscopy in this replacement. And you can assess again if the impingement have been removed. You must also use the fluoroscopy just to support your resection, and if you get loose, you can find you again if you use these X-rays. In the literature, there are a few papers talking about that. This is a paper from US in 2016 that mentioned a very small groups of patients. This is a 68 patients with failed on painful total hip replacement, mostly are resurfacing. And you can, first of all, establish the diagnosis. The problem when you approach this painful total hip is you are arthroscopy, you go with the arthroscope to get in, but before you have to know if the patient is not infection or a septic loosening of the components, because it will be fail your hip arthroscopy in this patient, and that's what this article mentioned. Another article from McCarthy in 2015, again, treat some cases of infection or trochanteric problems, or maybe some breakage of any instrument in these joints, screws, but mostly are failed hip arthroscopy in this case because you don't have the diagnosis at the beginning. So I recommend you to study the total hip replacement before doing hip arthroscopy and establish the diagnosis of this painful total hip replacement. You can do this debridement and improve this diagnosis. And also you have an infection, you can do a sample, get a sample from there to do the culture or remove any other fragments. You can also find sometimes small fractures of the ceramic on ceramic, and you can remove it, but also you get the assessment of the problem and the diagnosis with this hip arthroscopy. So in conclusion, we must say that this hip arthroscopy for painful hip replacement has a limit indications and looks like a dangerous and difficult tool like this python snake that you can see here. But sometimes in the correct indication and in the correct hands could be very safe and very useful. Thank you so much, everybody.